Hi, I'm Rajesh here. Today I'm going to demonstrate the hip examination. I would like to invite Mr. Ala. Ala, can you please come forward? Thanks for allowing me to do the hip examination. When the patient comes initially, I would like to test his gait first of all. So can you able to walk and show how you walk? So in this gait, I would like to assess whether he has any entargy gait or any treadle-bent gait. Or at the moment, the gait looks normal. Before that, I would like to assess his shoes also to see if there is any wearing of the shoes at any specific part of the sole. Secondly, I would like to evaluate further to see if there is any spine pathology present which can cause radiation of pain going down to the hip. So, Alok, can you able to face on this side? I would like to pinpoint the tenderness of the spinous process and see if there is any pain present or not. At the same time, I would like to find any tenderness over the paravertebral muscle spasm. If any spine pathology, he will have a tenderness over these areas. Thirdly, I would like to rule out any kidney pathology by doing the renal punch test, by palpating the renal angle and giving a renal punch over here or on this side. If it doesn't have that pain, that means it excludes the kidney problem. Thirdly, I would like to grossly examine the range of motion of the spine. Alok, can you be able to stand straight? Face this side. Can you be able to bend down? Can you be able to touch the toes? Very good. Flexion. Can you go behind? Extension. Can you be able to touch one side? Lateral rotation on this side. So this, he has a fairly good amount of range of motion of the spine. So that excludes his spine pathology grossly. Now, very important, while doing the hip examination, we would like to do the Trendelenburg test. The Trendelenburg test is important in evaluating the gluteus medius muscle, any weakness present or not. So how do we do that? We have to compare, you have to palpate the iliac crest on both the sides, one on right side, one on the left side. I would like to assess by doing this by lifting the leg one up. Alok, can you be able to lift one leg up and see whether if there is any drooping of the pelvis down or not? On the other side, can you be able to do that? Same thing. So it's more. So it's maintaining its level of the pelvis both sides. So that indicates that the gluteus muscles are strong. If the gluteus muscle is weak on left side, then the right side pelvis will droop down. The best thing is like sound side will droop down. So that will indicate that there might be some osteoarthritis of the hip, or he might have a congenital dislocation of the hip previously. So this, after this, I would like to ask him to lie down, supine position. And I will now proceed with my hip examination after evaluating other spine problems. Grossly, I would like to square the pelvis. So how do we square the pelvis? Tell him to lie down very straight without tilting the pelvis. I like to palpate the anterior superior iliac spine, square the pelvis, and grossly look for any limb length discrepancy. So how do we see that limb length discrepancy? By comparing the medial malleus at the both same size. At the same time, I would like to inspect by seeing the attitude of the leg. So usually the attitude of the leg, if it is in external rotation, more flexed and external rotation like this, there might be having a flexion contracture of the hip, or he might have a intertrochanteric or a neck of femur fracture, which is usually have this type of attitude. Okay, so now after this, I would like to go to find out any local tenderness present over the hip joint. So palpate the anterior superior iliac spine. So how do we do that? Go from the medial aspect of the pubic tuberculosis, palpate proximally, go till you hit the bone which is the anterior superior iliac spine. From here the iliopsoas muscle originates. So if there is any tenderness over that area, that means he might be having some tendinitis of the iliopsoas muscle. Just go below the anterior superior iliac spine will be the anterior inferior iliac spine, where the rectus femoris muscle originates. So if he has some tenderness over that area, that means it's going in favor of some rectus femoris tendinitis. Then from the ASIs again, go towards medial aspect where you can palpate the pubic symphysis. If he has some stress fracture, he will have a tenderness over that area. From this point again, go a bit more medially where you can hit the pubic tubercle. So if the patient has an osteitis pubis, he will have a tenderness over that area. Then once the anterior area of the hip joint is palpated, go to the lateral aspect. Can you able to turn on one side, this side? So in this, you have to palpate the greater trochanter, which is the bony prominence over the lateral aspect of the hip. So if he has any tenderness over that area, that means there might be some bursitis of the greater trochanter. Second thing very commonly seen in athletes is the IT band syndrome or a snapping hip syndrome, which can be also tender when palpating that greater trochanter. This I will be able to demonstrate the Ober's test later to find if there is any tightness of the IT band syndrome. Lastly, I would like to go posteriorly and palpate deep over the posterior aspect where the piriformis muscles originates. Sometimes the person will have a pain over that area, and sometimes will have a radiation of the pain going down the thigh. So that can mimic the hip pathology also. Secondly, if there is any tenderness over little bit inferior to that, there's the ischial tuberosity where the origin of the hamstring muscles comes. So if there is a tenderness over that area, that means he might be having a hamstring tendinitis or a ischial tuberosity bursitis. Lastly, I would like to flex his hip a little bit and external rotation and palpate for medial aspect of the thigh. If there is any tenderness over this area, that means he might be having some tendinitis of the adductor muscles or the sartorius muscle. If he has some numbness over this medial aspect of the thigh, that means he might be having some obturator nerve impingement. At the same time, on inspection, would like to inspect if there is any scars, sinuses, which indicates he might be having a previous operations or surgery, which can give further help in further management. Okay. After palpation, I would like to now do the range of motion of the hip. So range of the motion of the hips are divided into flexion, extension, abduction, adduction, external rotation and internal rotation. So grossly in the clinic, when we have a limited time, we just roll on the hip internal rotation and external rotation to exclude any hip pathology. Same thing on the opposite side. Now in flexion, always try to obliterate, if you want to see the flexion, obliterate the lumbar lordosis. So how do we do that? By squaring the pelvis and then able to flex the hip. Can you able to flex the hip? So he has almost, can you able to flex this also here? Can you able to hold this, guys? So if you see, it's almost flat. So this obliterates the lumbar lordosis. So this is the exact flexion which he has almost full at the moment. Can you just relax? Then in abduction again also, I would like to square the pelvis by again holding the anterior superior iliac spine at the same level and try to abduct. This is the abduction or abduction. This is the adduction or adduction. Then how do we test the internal rotation? Flex the hip at 90 degree, knee at the 90 degree, and then this is your internal rotation, this is your external rotation. So this completes the range of motion of the hip. Then at the same time, I would like to test the power of the muscles around the hip joint. So flexion of the hip, which is the quadriceps. Can you able to raise your leg up strong? So this is the quadriceps. Can you able to squeeze the thigh inside? This is the internal rotation. Can you squeeze it outside? This is external rotation. And in extension, can you able to lie on your face? So for the extension, can you able to raise this leg up? This is, I'm testing the hamstring muscles. When I bend the knee, can you raise the hip up? I'm testing the gluteus maximus. So this is for the extension. Thanks a lot. Can you able to lie down, face up? So now the range of power has been tested. So I will do some special tests regarding the hips. So one thing is to rule out the SI joint pathology. So for that, I do a Faber test. So Faber test stands for flexion, abduction and external rotation. So how do we do that? This is a flexion, this is the abduction and external rotation. And I stabilize the pelvis on the opposite side. If he has a pain on the same side, that means there is some SI joint pathology. The second way to do one more test for the SI joint is, can you able to lie down one side? Yeah. I will try to do the compression test at the SI joint, and then he will have a pain over the SI joint. That also goes in favor of SI joint pathology. Can you just lie down one side? The another test which I would like to do is the Faddel's test. Faddel's test is flexion, adduction and internal rotation. This test is used to detect any labral tear or any loose bodies in the hip joints. So how do we do that? This is, I have to flex the hip, adduction and then internal rotation. So if he has that pain over that area, that indicates there might be some lateral tear or impingement. Then Thomas test, which is very commonly done to find out fixed flexion contracture. So how do we do that? Again, we have to obliterate the lumbar lordosis, which I told you there shouldn't be a gap over here. So how do we do that? Tell him to hold the like this. Same time also this knee also try to press it. Okay, can you able to straighten this knee now? So if you see, he can almost extend the hip almost. So there is no flexion contracture of the hip. So this is called the Thomas test. The same thing you can do on the opposite side. You can straighten the this thing. So you can do full extension. So there is no flexion contracture of the hip. The another test which I would like to do is as a Ober test. That is for the IT band syndrome. Can you put a lie down on one side? So IT band, if it is very tight, I would like to extend the hip first and then flex the knee and try to put it down. If he has a tight IT band, he will not able to put the knee down. The IT band will hold the knee up. That is tightness of the IT band syndrome. Yeah. Can you? Okay. Lastly, I would like to complete my examination by doing a neurological examination grossly. So I would like to do the SLR, straight leg raising test, by extending the knee, by holding pressing the thigh down so that it prevents flexion, and try to raise. So he has almost 90-degree straight leg raising test. At the same time, I would like to see the sensation. So this is the L3 dermatome. Can you feel I'm setting? Can you feel? This is L4, this is L5, this is S1. So all the dermatomes are intact. Grossly, I would like to test the power. Can you push your ankle up towards you? This is L4. Toes towards you. This is L5. And push the down. This is S1 myotome. So grossly, no neurovascular deficit. I will complete my examination by doing the foot pulses, which is dorsalis pedis and posterior tibialis. One couple of tests I forgot to do this. To find out any stress fracture or anything, I would like to raise the leg and do the tapping over here, or over the knee, or over the retrograde. If he has some pain, that shows they might be having a stress fracture. Secondly, for the piriformis, I would like to stress the piriformis by adduction and flexion the hip. If he has some pain over that area, over the posterior aspect of the gluteus, that goes in favor of piriformis syndrome. And then lastly, for the SI joint, can you just stand up? Can you able to stand on one leg? Yeah. Can you able to stand on one stance and try to locate the SI joint, which is at the iliac crest level, going toward the SI joint. That's the two dimples. If he has a pain and do some extension at the spine, if he has a tenderness over that area, that shows there might be some SI joint pathology, or he might be having lumbar spondylolysis. So I think this completes my whole hip examination. Thank you, Alaf, for allowing me to do that.